Good morning. I'm Alisa Zee. Thank you for spending this Sunday morning here with us. You're listening to the Sunday edition. I'm so happy it's spring. Everybody knows that one day that I go out for my first walk of the day and I'm not worried about slipping on the ice makes me so happy. Of course, a couple of weeks ago I tripped on some uneven pavement and totally messed up my face and my glasses, but you know what? We don't bounce like we once did. However, I'm also realizing that there are some things I can do to take control of what happens with my body. Some things my daddy always used to say, boy, this getting old, I don't know if we're supposed to live this long. And then I think, you know what, growing old is great, or older. It's the falling apart stuff that gets in the way of our joy, of our love for moving. And everybody I've spoken with, whether in the medical profession or outside the medical profession, says activity is key. Whether it was last week when I chatted with someone from the Parkinson's Foundation, or I speak with the gentleman who's with me today. We're talking about orthopedics in a way I've never heard of before. So, Dr. Ron Lederman with Regenerate Ortho. We almost forgot to go on the air because we've been having such a good chat here and we know a ton of people together. But I do want to help people avoid some surgeries if possible. So first of all, thank you for being here and good morning.
Oh, good morning. It is my pleasure. Thank you for having me.
We also found out we have much in common, both being born in Cleveland, but then we both somehow, our families knew to see the error of their ways, and we both went to University of Michigan. Go Blue!
Go Blue, baby.
So when we're looking at our bodies, not just from aging, but from activity, from injury, from illness, from ailment, a lot of people, I hurt my knee, next step, surgery. Oh no, shoulder problem, let's do a replacement, and on and on and on. Ron, you're here to tell me that that doesn't always have to be the case anymore, right?
Alisa, that is correct. And you're talking to someone that, as a board-certified, fellowship-trained orthopedic surgeon, I was trained for 14 years on how to do surgery, and I did a lot of surgery for 20, 25 years. But during that process, I also gained a very healthy respect for the what patients have to go through to have those surgeries, whether it be a shoulder or a knee replacement or hip replacements. And for the past 7 years or so, I've been pioneering regenerative injection therapy to help my patients with their arthritic pains and everything that comes along with it, like you alluded to.
Right.
We want to get out there and move. We have a saying in orthopedics, if you don't use it, you lose it.
Yes, yes.
So for patients that come to me, they're often surprised that they don't need that knee replacement that one of my colleagues just told them they need.
Right.
And I don't fault my colleagues for suggesting that because it may very well be indicated.
Sure.
However, I am doing everything I can to keep my patients out of the operating room. And why is that? I always say to myself, how would I want my own family member to be treated? And if my wife or one of my kids can get better without surgery, why not?
Of course.
You can avoid the potential complications of surgery, whether it be infection or all of the other things that can go wrong. And at Regenerate Ortho, I started this company because I've been pioneering different regenerative injection therapies, even in bone-on-bone joints.
That's amazing.
That are giving patients tremendous pain relief. I often combine it with physical therapy.
Very important.
We want to get the joints moving again. We want to strengthen the muscles that have become atrophied because we've babied that joint.
Right.
We don't want to use it because it's been hurting so much. Well, we reversed that whole trend, and I can tell you that even patients with bone-on-bone arthritis, when they get a regenerative therapy at Regenerate Ortho, which we are seeing patients in Lederman Quarterwitz Orthopedics, which is the practice that we've had for 20, 30 years now. Patients will get a one-time treatment. They'll walk out to their car. Often they're telling me that night or the next day they noticed pain improvement.
Really?
And the whole idea is improve quality of life.
Yes.
Keep moving. Keep doing the things you like to do, whether it be taking a walk, playing golf, pickleball. I've got 2 young grandchildren. You have a beautiful young granddaughter. And the idea is to be able to get on the ground with them and be able to get back up.
Exactly. That is exactly, because when I was younger, I thought, okay, I want to remain in good health so I can keep rolling around with my kids. And now I'm a grandma. And yes, I want to get down on the floor with her and then pick her up. Or when she runs to me for a hug, I want to lift her up. It's not as easy as it once was, but I'm thankfully strong enough to do it. But I do worry, and that is why I want to stay on top of things.
Well, I couldn't agree with you more. And I loved your comment earlier when you said, we don't bounce the way we used to. It's true. Do you remember falling off your bike or just stumbling and going to the ground? It was no big deal. You get right back up. It's a big deal when you're in your 50s, 60s, 70s, or 80s.
Yikes, yes.
And so I'm seeing patients at Regenerate Ortho that are 45 years and older.
Okay.
They may have arthritis in their shoulder, their knee, their hip, their ankle, and it could be genetic. It could be from an old injury. For example, 30 years ago, I had a bad ski accident, and I injured my knee and my shoulder.
Okay.
And fast forward 30 years later and some surgeries later, I've got bone-on-bone arthritis.
Of course.
And I've been told that I need joint replacement, and I have been able to kick that can down the road now for over 7 years with these regenerative injection treatments that I'm doing.
Now, when I went to the podiatrist a few weeks ago, I had a trip to D.C. coming up. I wanted to walk all around the Tidal Basin and see the cherry blossoms, and I did. And I walked miles and miles over a couple of days. Before I went to my podiatrist. You know Eric Foreman. We love him.
The best.
And I said, I think I have a stress fracture. He said, it's acting like it. Let's x-ray. It wasn't. It was like a tendonitis and inflammation. And he said, it's where I have it is very common in women, and as we get older, it gets exacerbated, I guess, because I used to wear grown-up shoes. Maybe that had something to do with it. So he gave me a cortisone injection, which helped. It's still not perfect, so maybe before my next trip I'll come see you. But he gave me a cortisone injection, and it was very, very helpful. How is this different than that? Because most of us have had somewhere cortisone injections.
Correct, myself included.
Okay.
And I've given thousands of them. I have really transitioned from cortisone shots, which act as a short-term covering up of the inflammation, which is good if you're going on a trip and you want to get rid of some of that pain short-term.
Right.
The problem with cortisone is it can also weaken the tissues that it's decreasing the inflammation at.
Yes.
And with regenerative injections, I'm doing PRP or these protein concentrate or even the quote-unquote stem cell injections in tendon sheaths, like your posterior tibial tendon, your Achilles tendon, your peroneal tendons, or for tennis elbow and golfer's elbow. We're doing these injections that will actually regenerate and strengthen the tendons while at the same time decreasing the pain.
Wow.
Instead of a cortisone shot, which just masks the pain, but could potentially weaken these tendons.
Right.
So I'm glad you brought that up, because we've really only been talking about these different types of injections for arthritic joints.
Right.
But you can also use them a lot for the tendons that keep us moving and keep us strong.
And keep everything connected.
Yes.
So as you are pioneering this treatment and have been for the last several years, why aren't more people, more physicians climbing on board? And why am I just now hearing about this?
Well, I think I know the answer.
Okay.
My colleagues and I went to school and trained for up to 14 years to be able to do what we do in the operating room. And therefore, the operating room is typically our happy place.
Right.
It's where we're really utilizing our craft and getting most of our patients better that way.
Sure.
As I said earlier, I have gained and developed such a healthy respect for the potential complications of major surgery that I started looking at ways to keep my patients out of the operating room.
Right.
And with my own orthopedic issues, my bone-on-bone shoulder and knee, and I love to work out, exercise almost every day.
And you ride your bike and everything else. You're very active.
Almost every day. Mountain bike, elliptical, pickleball. So
boy, make me feel like a wimp.
And then and then sleep. Let's
I
just
carried
talk
my
about,
laundry up the stairs this morning.
and we want to keep people being able to do that.
Yes.
That 85-year-old person that might have lost their spouse is living in the home they've been in for 40 years. They're having difficulty maintaining that because they can't do stairs. These are some of the people that will come to me and get these regenerative injection therapies and then call me back and say, this has been a miracle. I don't have to move. I'm going up and down my stairs. I can do my laundry. It's really remarkable. But the reason we're just starting to hear about it now is, number one, my colleagues, we enjoy operating. We do. We're good at it, and it does help most of our patients.
Sure.
I have simply taken a different approach. And I, again, always go back to what would I want to do if it were me or my family members? And I am walking the walk. I have gotten a PRP, which stands for platelet-rich plasma, and I've gotten a quote-unquote stem cell, or these orthobiologics from the human umbilical cord that we keep on site, and we get those that from the mother that donates those tissues after a healthy newborn delivery.
Okay, because you knew that question was coming.
Absolutely. No. We use cells from the human umbilical cord that are donated by the mom after a healthy newborn delivery. It goes to one of the only labs in the country that is certified and qualified to screen it and store it, and we actually keep them on site in a deep liquid nitrogen freeze tank.
So you have it when you need it. It's right there. Does insurance cover this?
Unfortunately, they don't.
And that's so sad.
It is sad. And will it ever change? I don't know.
Right.
I don't know. We certainly will take hardship cases and do whatever we can for patients. But it is, so what I have done, what I've determined is that if you take some of these different regenerative injection therapy materials, whether it be your own PRP or something new now that we are using through new high-tech filtration systems, a protein concentrate that's also from your own blood products. And these have very powerful anti-inflammatory, anti-pain properties.
Amazing. I love this.
And then if you include that even with some of these other orthobiologics, you can really offer a Cadillac treatment in a one and done, one time only injection where you walk out of the office and hopefully you appreciate dramatic decrease in pain and increase in your functional capabilities. And I have patients where these treatments are lasting for 5 years at this point.
This is unbelievable. And yet it's not a new concept. We're familiar with stem cell and the miracle that can happen with those kinds of injections, infusions, whatever the correct terminology is. So why not in our tendons, our joints, where there's bone on bone, or even if it's not that bad, to keep it from getting there? I can't believe we are almost out of time. You're going to have to come back, please. Well, I'm not going to give you an order, but I am going to ask here and now in front of listeners and everybody, will you come back again? Because I have so many more questions.
It would be my honor and my pleasure.
Thank you. In the meantime, tell us where we can get more information, please.
Well, if you want to go to regenerateortho.com. That should give you all the information you would need, regenerateortho.com. And if you're listening in the area of Southeast Michigan, you've heard of Lederman Orthopedics, and we're in West Bloomfield and Brighton and Troy, but West Bloomfield's our main office.
Sure.
And feel free to reach out to us, and we'd love to help take care of you.
And I just want to hear more and more stories. You know what? Tell me a 30-second story of somebody. It can be you.
Well, it can be me. So my bone on bone in my shoulder and my knee, and I was being threatened and not being able to do all the things I love to do. I've received these injection treatments, and I'm in a pickleball league playing 1.5 to 2 hours of pickleball 2 to 3 times a week with no knee pain. It's amazing.
That's amazing.
This is an emerging field. It's changing all the time, and we are now using a hyper triple concentrated PRP, which I anticipate will be even more effective than what I've been using for 7 years now.
I am excited to hear more and more and more. Dr. Ron Lederman with Regenerate Ortho. Wow, you're saving lives in many, many ways, helping people avoid surgery and keeping us on track to be strong and healthy for a whole lot longer. Thank you very much for being here.
Thank you so very much. I appreciate those kind words.
Boy, oh boy, my mind is a little bit blown. And thank you to each and every one of you. You know I'm always grateful when you choose to spend some of your Sunday morning here with us. I'm Alisa Zee. You're listening to the Sunday Edition.